the best way to just kind of introduce you all to Signature Primary Care would be to share some information about kind of why we're doing what we're doing and why we would love for you to join us. So I'll share my screen, and there's a few slides to help guide us. That is myself on the left and the lovely Dr. Robin Newburn. And we work at Signature Primary Care and Wellness. So what we wanted to chat about today is just a little bit about our philosophy of thinking about medicine differently and thinking about your health differently, and offer you an invitation to join us if you think it would be helpful for you. I just wanted to invite everyone to just dedicate this time to yourself. It can be so easy to like multitask and be thinking of a million things, but we want you to share this time with you. Our primary question is, do you have a primary care physician that you trust and who is there for you when you need them? And that is the primary frustration that we were hearing from patients in our former practices and what we hear from patients every day now. Primary care can be a little bit of I don't know if it's misunderstood or just unclear. And it saddens me, honestly, that there are so many people who have never experienced the value of having an ongoing relationship with a trusted primary care doctor. So I just kind of wanted to introduce you all to a little bit about what we do. We are family medicine physicians, and so we provide comprehensive primary care, which statistically speaking can cover 80% of people's healthcare needs. And so sometimes we don't realize, if we've been busy like going to urgent cares or ERs or seeing specialists here or there, how much primary care can cover. Primary care really focuses on not only dealing with as needed problems, acute issues, but also with ongoing issues, chronic issues, as well as preventing future issues. And so we really try to be as comprehensive as possible and help people from, really primary care is designed from birth till death. Especially in our philosophy, primary care is definitely more than just a pill. Part of the reason that we designed this practice was really to be able to spend more time with people and to talk about all the root causes of issues and be able to recommend more than just what some people call a pill for every ill. But as some of you might already realize, primary care in an insurance-based system really muddies the water. So we found that it's inconvenient and rushed and just really focuses on very fragmented sick care as opposed to getting better and being well care. Not to mention that insurance in and of itself is very high cost and very unpredictable cost. And if you're trying to function or get help in the healthcare system, not having insurance or having a high deductible plan where you don't get a lot of care until you've met a $4, $6, $8, $10,000 deductible, it's really unpredictable. We just started recognizing that as physicians and our patients were feeling frustrated and unheard and rushed and confused. And so we decided to do things a little differently. So like I mentioned, we're family physicians, board certified, trained in osteopathic medical schools and residency programs. For those who aren't familiar, osteopathic physicians are very similar to allopathic physicians in their training, as far as we, take similar classes and pass all the same boards and certifications, but we really train in a more holistic model, viewing mind, body, spirit, structure of the body, a little bit differently than allopathic physicians. After kind of functioning in a traditional system, we decided to step outside the box a little bit and combined not only the best of our traditional osteopathic training, but also delve into more lifestyle techniques, functional medicine techniques, integrative techniques, so that we could truly help people feel better. What we envisioned is what primary care can be, which is really more holistic, comprehensive, personalized, which is particularly why I love sharing this with groups of people in their place of employment, because we just sometimes underestimate how much your physician knowing where you work every day and what you're going through and who you're serving and how we can personalize your care to help meet the needs of what you're going through when you're putting yourself out there every day to serve other people, as well as kind of know ahead of time what things you can do to keep yourself well, knowing how you're spending your time every day. And so we wanted primary care to have that personalization both to your individual lifestyle and your workplace, as well as be more convenient and affordable, respectful of your wishes and your time, not only personalized but personable. We all really see our patients as friends and colleagues in a way, working together towards your health. And I personally thought, if we're going to do this every day, we might as well have a little bit of fun too. So we try to put that in there. We want to invite you to become a member of Signature Primary Care and Wellness. It's a little bit different to talk about healthcare as a membership, but we found that it is the way to be able to partner with people in a more meaningful way. What we want to provide you is really direct access to us. In our former models, oftentimes we had to kind of share time, and there might be a lot of different physicians on call or working with nurse practitioners, or have patients who had to visit an urgent care or minute clinic or ER quite a bit in between visits. But we dedicate ourselves to be directly available to you so that you can have the reassurance that you have a doctor that knows you and knows your lifestyle and knows your history really well. Like I mentioned earlier, we want to really just be able to have relaxed visits in a very healing space with you and not be rushed to deal with things quickly or deal with one thing each visit. Part of the magic of Signature Primary Care and this membership model is that we keep our panels fairly small so that we can block out time to be available for urgent issues, same day, next day, and really be able to work around your work schedule so you're not having to miss too much to be able to take care of yourself. In addition to meeting in person, we've really leaned into technology. I don't know if it's ever crossed your mind when it comes to going to the doctor, but asking a question or sometimes reviewing test results or just talking things over. It's such a production sometimes to make an appointment and go in and go through a lot of processes and wait in a room, and it just takes a long time. So a lot of those things we can serve very well through technology, whether it's talking on the phone or doing a video visit or texting back and forth. So we really want to partner with people the way that they see best. Some people love to come to the visit to inside the office all the time. Some people really are comfortable doing a lot virtually. As part of our membership, as we don't function inside the insurance system, we're able to offer really a lot of the things that we do in-house rolled into that membership. So when it comes to services that we can provide in the office in the way of, maybe it's a urine test or strep test or an EKG or breathing treatments, flushing out your ears, all of those things are provided at no extra cost. And those are a lot of the things that really drive up healthcare costs, because when you go to your doctor and you might be expecting to pay a copay, or you might be expecting just to pay towards your deductible for their fees, every little piece of data that we benefit from getting in the office through extra testing, when it's charged to insurance, can be really expensive. But when it comes down to functioning outside the insurance system, we can offer that at no extra charge. In addition to providing the kind of free items within our membership, what we really love doing is helping people navigate the healthcare system for things that you need outside the office. So the occasion might come up where you need to have blood testing or x-rays or MRIs or even, visits with specialists. And so we have done our best to partner with outside facilities and other physicians that are committed to providing affordable care. And so it looks a little bit different depending on the test, but one example would be blood work. We partner with a lab called Quest, and we draw your blood in the office. Quest sends us the bill, and we pay it on your behalf, and they're able to charge us a very discounted kind of wholesale rate, and then you reimburse us at cost for that testing. And so as an example, a full set of blood work that would be hundreds of dollars through as a self-pay, or if that blood work hit your deductible, we're able to offer for about $60. So that really has been helpful for patients when it comes to checking blood counts and kidney, liver, electrolytes, glucose, thyroid, whatever it is. Another area that we love partnering with patients to decrease their outside costs is related to medications and supplements. And so again, it looks different. With some people, it's helping them navigate their insurance plan. For some people, it's helping them navigate where the cheapest medication is with certain discount plans. Or for vitamins and supplements, we have a brand that we order wholesale in the office and just pass along that discount to you as part of your membership. One of the things I mentioned before, and I probably sound like a broken record, but we really truly formed this practice to have more of a wellness focus. Our current healthcare system does not necessarily do a service to true wellness. It's very busy either waiting till something's broke until they fix it rather than preventing problems, or kind of not getting to the root cause of issues and not supporting people enough in their lifestyle and habits and other activities that create true wellness. And so we love helping people get off of medications and reverse issues and really just, get to the root cause of what they're going through. Really what we were after is doing primary care in a different way, a higher quality way, but also still being able to provide that care in a very affordable way and predictable way. These are some of the questions that we tend to get quite a bit, so I thought I would just go through some of them here with you all today. A lot of people might ask, okay, if I'm paying for your services through a membership, what about traditional insurance? We always recommend that patients have some sort of traditional insurance if they feel most comfortable being covered for that care outside of the office. So for some people, that might be a high deductible plan, catastrophic coverage, a health sharing account. Some of the Christians and secular health share plans partner really well with direct primary care. And so many people find that they're more comfortable having that coverage if something happens. If you need a surgery, if you get in a bad accident, if you need to go to the ER, that's what that coverage is really designed for. But the reality is, unfortunately, oftentimes that type of insurance can be very expensive. And so we are more than happy to partner with people who don't have traditional insurance because, like I said, traditional primary care, statistically speaking, can handle 80% of those acute care, preventive care, chronic care needs. For people who do have insurance, we still help them navigate what's the most cost-effective way to go about things, what preferred specialists or preferred labs or preferred healthcare systems for testing that your insurance might require. So we help you kind of navigate what the most cost-effective way to go about things is. Same thing for medications, really. Some people prefer to use insurance for medications. Some people prefer to use self-pay methods for insurance. And so we just help you compare that pricing and get the best care for the cheapest price. Similar for testing and referrals, we are still we work with all the healthcare systems in the city, whether it's Mount Carmel based, Ohio Health, OSU, and have a wide variety of specialists and testing familiarity, and our relationships that we've built being in the area for 15, 20 years. And we work closely with local specialists for testing and help you navigate those costs as well. Some people are very much accustomed to using HSA and FSA accounts. And so that's a health sharing account or a flexible spending account. And those accounts, if you happen to be familiar with them or have access to them, our membership, it can come out of those accounts. And so we can work with people to help navigate that too. Sometimes on a bad day, you love reading nice things that people have to say, and our patients are so nice. And so it's really heartwarming when we think about the kinds of things that we've been able to help people with in this model compared to a traditional model. When we hear patient stories about kind of feeling how they've had trouble navigating the system and they've delayed their care because they didn't think they could afford it, or didn't know how much something was, or they never really had time to talk about all the little questions that they had. I sometimes jokingly tell people that we love being Dr. Google. Like, you don't have to spend all your time researching on the internet anymore. You just can call us or text us and ask us. And I really feel strongly that, we went into primary care because we love partnering with people, getting to know them over a long period of time, and kind of knowing about your life and how to usher you through different health challenges in life. And so it really means a lot to us to partner with patients and that they feel cared for. Like I mentioned before, we work on a membership model. And so we really want to get people away from having to worry about unpredictable fees and deductibles and copays and coinsurance that, can show up later on. We work with your employer to come up with that flat monthly fee. And some employers pass that along totally to their employees. Some employers share that as a benefit. And so your employer is interested in sharing that benefit with you, and we're happy to partner with them. As far as next steps, we can work together with your employer to kind of determine next steps and just let them know that you're interested. If you have any questions that we didn't answer here, feel free to go to the website. It's www.signaturecare.co. And there is a little widget in the lower right-hand corner. You can send us a direct message with that if there's any questions that we didn't cover today, or you can give us a call or a text on our phone number that's on that website too. I know your group will work together to kind of get us a sign-up list, and we look forward to meeting you in the office.